So once again, welcome to today's training, trauma training for workforce development professionals. And before I begin with our core content today, I want to go ahead and turn it over to our partners at Arches, who operate the Neighborhood Healing Network, who have made this training possible. So with that, I want to go ahead and introduce our Arches collaborators. I want to introduce Les Johnson as well as Brittany Radford as they introduce to us the Neighborhood Healing Network and talk to us about some of the services and opportunities provided as this unique funding opportunity we have in the St. Louis area. So Les and Brittany, I'm going to turn it over to you all to get us rolling right along as we talk about the Neighborhood Healing Network here in St. Louis.
Thanks, Sean. Good morning, everyone, on this cold and crisp morning in St. Louis and wherever you may be in the surrounding areas. Thank you for participating in joining us for today's workshop training / webinar. Prior to COVID-19, these workshops were intended to be in-person, face-to-face engagement. However, due to COVID, we had to make that pivot, and we've adapted, and now all of these trainings will be virtual. Again, it is my pleasure to share with you a new initiative that is being sponsored by Arches. It's called the Neighborhood Healing Network, and it's funded by the Missouri Department of Social Services, and we are also in partnership with the Missouri Department of Public Safety. And what Arches, this is new territory for us this year with the Neighborhood Healing Network. Arches, we looked at the high level and incidents of violence within the community, and we determined that we must do something about it. All of the programs that we operate in the St. Louis region have been impacted in some way, shape, or form by violence. I'm sure most of you can attest, or that you know someone, or you have served customers coming through your workforce development doors who have been impacted or exposed to violence in some way, shape, or form. They may have themselves been victims of crime, or they may have been exposed by the communities that they live in terms of exposure to crime. And so we've developed the Neighborhood Healing Network. And part of the strategy with the Neighborhood Healing Network is to host a series of workshops. We have community presentations that are occurring from now throughout the end of the fiscal year, which ends in June 30th. But we also have a series of 4 high-level workshops that are targeting professionals and paraprofessionals across various sectors. The first training that was hosted about a month ago targeted the early childhood sector. This training today will focus on individuals who are working directly with workforce development or job seekers that are coming into your doors seeking employment and training opportunities for employment. And then we also will have 2 additional workshops that will occur at the beginning of next year. Those will focus on school-aged services for those individuals that are working in school environments. And then lastly, we will have a workshop targeting the faith-based community. And so the culmination of these workshops, we hope, will provide individuals that are working in these various sectors with an opportunity to slow down, reflect on how individuals that come through your doors are being impacted by violence, so that you have a better understanding of how to engage with those individuals and have a better understanding of how trauma impacts some of the decisions that they make in their daily lives. And so sometimes when things don't quite work out right, and you're wondering and asking yourselves, well, why aren't they being compliant? Why is it that we can't, gain their cooperation and trust? Sometimes there's some issues related to trauma that need to be addressed and allow for them to work through that process. So we hope that by providing these professional development opportunities through the Neighborhood Healing Network, that we will afford you that opportunity to engage in that way. So at this time, I'd like to turn the presentation over to the director of the Neighborhood Healing Network, Ms. Brittany Radford, and she's going to talk to you more specifically about the program services that are being offered through the Neighborhood Healing Network. Brittany?
Thank you, Les. Good morning. As Les stated, my name is Brittany Radford, and I am tasked with providing oversight with the Neighborhood Healing Network. As Les has stated, we've seen in the media that St. Louis region continues to see alarming increases not only in neglect, crime, and community violence, but it is further exacerbated with COVID. As each of you know, due to your roles, that adults are facing high alarming rates as it pertains to layoffs, limited work schedules, having to work remotely. And so, what we're seeking to do today is to provide you a training that has you have a greater context of what that looks like, but also to familiarize you with the Neighborhood Healing Network so that you can provide this new support to your clients. And so, I want to just provide you with a little background about what the Neighborhood Healing is, as well as the core services that we provide. And so, as you see on the screen, there are 5 different logos that make up the Neighborhood Healing Network in conjunction with ARCHES. And so, how we see this is it's a strategic partnership between 5 trusted organizations across St. Louis City and County. And so those organizations include Better Family Life, the Boys and Girls Club of Greater St. Louis, Fathers and Family Support Center, Mission St. Louis, and the Urban League of Metropolitan St. Louis. These organizations were intentionally selected due to the continuous history that they have had impacting the lives of adults. And so, how we've strategized this is that it's composed of 5 hub sites to ensure that adults that have experienced some degree of victimization within St. Louis County and region are able to get quality support as well as resources from local victim service agencies and social service agencies. So often when I talk about the project, I see it more so as a connector. We see it in the sense that we want to streamline victim support services with intensive case management. So that is done by working closely with community residents, where we have 1 of 5 community resource specialists housed at the 5 sites that you see on the screen to more so represent this circular effect of making sure that individuals have the knowledge of what is available in their community, but also to make sure that they feel equipped to take the necessary steps towards recovery. And so ultimately, what we're seeking to do with the Neighborhood Healing Network is to increase adult victims' protective factors for dealing with trauma and then decrease their risk factors for negative health outcomes as well as violence. And so we offer 3 specific core services for the Neighborhood Healing Network for adults 18 or older. And so, what those services encompass is 1, connecting individuals to victim and social services. As Les previously stated, when individuals experience some degree of victimization, it is sometimes difficult in figuring out who's the right person to go to, what agency has these specific requirements. And so, how this is done is that we have 5 community resource specialists who work with community residents to locate what are the available crime victim services in the region, as well as what social services do they need to be able to live productive lives. And so each community resource specialist meets with the participants either remotely, via phone, via Zoom, or emailing them to make sure that they understand what are the requirements that they have to meet when they reach out to these agencies. In the past, it's often seen as like a handover, but we more so want to walk alongside them as they navigate such a difficult time. And another key thing that we are able to do is to assist them with finding the proper documentation as well as gathering the information for the Crime Victim Compensation Fund, because what we have seen based on research and just shared experiences is that individuals have needs and they're not able to understand of how to locate that financial support. So if an individual is seeking counseling or medical treatment, trying to understand the cost for covering funerals, they're able to fill out that application and get support in those financial means. And then another key part is providing emotional support. As you know, trauma is not only an isolated event, it occurs over time. And so what we're seeking to do is provide those trauma workshops to community residents so that they're aware of, like, this is what I'm experiencing, being able to articulate and understand the specific ways that they may have been impacted, but also how other individuals in their home, both their children, grandparents, may have experienced some degree of trauma. And so what the community resource specialist does is they meet with them, provide that emotional support, but then also be able to see them as a liaison to make sure that they are able to help both their children, their parents, as well as community residents navigate such a difficult time. Overall, one of the things that we're seeking to do with the Neighborhood Healing Network is to be able to see it as a collaborative approach so that each of the agencies that's currently on this call see us as a resource and a partner in being able to support the bigger picture of residents in both St. Louis City and County. And so if you know someone that may benefit from the Neighborhood Healing Network, you can have them reach out to one of our community resource specialists. I'm going to place the flyer in the chat, as well as provide my contact information. I know for our last training for early childhood professionals, several people had different questions. And so I followed up via email as well as via phone with them to just give a greater understanding of what the neighborhood healing is. And then also what are our program requirements. And as you know, we all have had to navigate towards remote working. And so we would like you to like our Facebook page, which I also will put in the chat. And to learn more about the initiative as a whole, you can visit our website at www.stlarches.org. And so I will ask, are there any questions about the Neighborhood Healing Network at this time?
And then also as the presentation moves along, there'll be an opportunity throughout the workshop to ask questions via the chat as well.
If not, I will hand it over back to Sean.
Before you hand it over to Sean, I'd like to say thank you to Alive and Well Communities, our partner, who has been responsible for facilitating the many trainings and presentations that have occurred thus far. Alive and Well is a tried and true partner to Arches. We truly appreciate the support that you're providing the St. Louis community. You're helping all of us gain a better understanding of trauma and the impact of trauma and its impact on the lives of just everyday people and how we can assist and be better informed to support those individuals who walk through our doors. So Sean, I'll turn it over to you.
So really quickly before we do turn it over, I want to just make sure that we do take an opportunity to answer all questions because the Neighborhood Healing Network is such a unique resource for our community and such a needed resource. One of the things I often hear when I'm out in the community is how do we connect folks to needed services, knowing that there are never enough trusted resources in our community. And as part of the brilliant design by the Neighborhood Healing Network, it's about connecting to trusted community agencies and embedding those resources within those agencies to ensure that our residents have access to those services. So I just want to double check that if you all have any questions about the program, about how to connect individuals, about what opportunities might be provided through this, I just want to make sure that you get all of those questions answered because this is such a unique and amazing resource for our community and for our residents as we work to disrupt trauma in the St. Louis region. Okay.
Hi, I do have a person that I would like to connect to your services. And so would you repeat for me the process for doing so? How
Yes.
to, thank
Yes.
you.
So if you look in the chat, I just uploaded the flyer that has all of the community resource specialist contact information. And so if they are closer to a specific region, that is one option, or you could just provide their information to me the via chat, and then I will get that to one of our community resource specialists to make sure that they're able to support that individual.
That would be great. And then typically, certainly based on what the needs are for each person, the timeline could be different. But if there is a situation where there is an urgent need, is there any sense of how quickly people can be mobilized or resources can be mobilized to meet the needs of a family who has lost everything?
In the sense to, or as regards to the victimization that they've experienced?
Correct.
So what we typically do is that the community resource specialist contacts them immediately once they get that information. And then they instantly, once they do the intake and assessment, they begin providing case management at that day. But seeing that we are a referral network, we make sure that when the participant is reaching out to that agency, that they are following through. So if they don't see a quick turnaround, then a community resource specialist works with the participant to see where's the breakdown and then begin able to navigate what should be the next steps. Does that
Great.
provide?
That does. Thank you.
You're welcome.
It looks like Samantha Cross did post in the chat as well.
So, Samantha, I think your question is asking what connections and resources do we have in regards to medical and government agencies? I think that's what you're asking. And so what we have provided all of our community resource specialists is they have a referral directory, as well as they already have networks within St. Louis County and region. And so depending on what the specific need is, that community resource specialist will work intentionally to figure out what specific agency is best for them based on their need. And then if they do reach out to a particular agency and it isn't a good fit, then they go back to the drawing wheel and determine what's the next steps to figure out if another agency is better aligned.
And I just want to share that it's really about them building those hubs, building relationships with the participants they serve, and really creating those warm introductions. And so it's not just saying, oh, call this number, but really supporting and navigating the various systems, because we do understand there's a lot of mistrust between the medical and also governmental resources in our community. And so that case manager then can be that front line and can walk alongside of any participant who's trying to access those services to ensure they have that buffer and that continuous relationship throughout the process.
That's correct, because the community resource specialists often will call with the participant, the particular agency. And if they're unable to get a response, then they follow up via email and continuously make sure that they need to understand what is happening so that the participant doesn't feel that they're just reaching out to another agency and no one is responsive and no one cares. We're seeking to be a buffer and mitigate that entire process by the community resource specialist providing case management over a window of time until they have met the goals that they have set out initially when they met with the community resource specialist. And if those goals have to be revised, then the community resource specialist works with them to do so. So, Lana, I will send the chat. I will respond to your message. You're welcome, Samantha. Are there any other questions?
So in a follow-up email after today's training, you'll not only receive the slide deck that we go through today, but you'll also receive those Arches Neighborhood Healing Network resources. So you have them readily available at your disposal. So also know that we'll provide contact information for Brittany so you can reach out whenever you have questions about the structure or maybe a specific case where you want to refer someone and you're not quite sure the process or where to refer to. So know that even beyond today's training, this is a resource available for you. So earlier, I introduced myself. My name is Sean Mars, and I'm the Director of Training and Technical Assistance with Alive and Well Communities. And Alive and Well Communities is proud to be part of this initiative of the Neighborhood Healing Network sponsored by Arches, as it aligns with our mission of really disrupting trauma and toxic stress in the regions we have the privilege of serving. So we're a proud partner with the Neighborhood Healing Network and really excited for this opportunity today. So before we go ahead and move on, remember that Brittany shared that connect to all the latest and greatest news from either Arches and the many opportunities and services that they provide, as well as connect on social media with the Neighborhood Healing Network to get the latest updates and learn more about the process. What we want to do before we get into today's training is, as a facilitator and recognizing that virtual learning is something that's a bit different for all of us, I just want to take a moment to understand, as a facilitator, how are you all showing up today and how are you doing? And so what I'm going to ask you to do is I'm going to ask you to join me on your phones or either in a spare browser, and I'm going to ask you to go to menti, menti.com, and put in the code that you either see at the top of your screen or that I've put in the chat box, which is 39 23 25 8. And this is going to be a way for us in real time just to connect with one another. And the really nice thing about this interactive participant software that we'll be using today, this Mentimeter, is that it allows me to get to interact with you differently. You get to provide your responses anonymously. And the only thing I can see as a facilitator is the number of people who responded. So I'm going to ask you to get on your phone or go to a spare browser and go ahead and share with us, how is it that you're feeling today?
Mhm. Okay. Give me a second. I just walked in.
So as we see those responses rolling in, and I just want to echo Joy and Monique as they share, yes, this is Mentimeter, and it's a great resource if you're doing some virtual learning. And I just want to take a moment to honor and recognize that we're showing up really kind of all across the board, everything from overwhelmed, tired, anxious, busy, to ready, peace, well, determined, to excited, great, and wanting to truly honor that this is how we're showing up during this unique and stressful time. And so one of the things I really want to impress upon you all as we talk today about trauma and toxic stress is wanting to honor that this is how we're showing up. So at any point, if you need to take a break before we engage in a break, please feel empowered to do so. Please feel empowered that as you make connections to either your professional work or your personal lives, that you're taking excellent care of yourselves throughout this time. I also just want to kind of put into recognition, thinking about if this is how we're showing up as professionals, whether we're in workforce development, the criminal justice sector, or maybe even an employer, think about how our employees, our clients, those where we're charged with caring for, may be showing up themselves. Now, before we move on into the actual training content, I want to follow up with another question. And I just want to honor that virtual learning is a lot different than learning in person. And I don't know about you all, but it seems like now my life has become Zoom meeting after Zoom meeting after Zoom meeting after Zoom meeting. That probably when you thought about logging in today, you might have been thinking, wow, 4 hours of being on a Zoom. And that's okay. Let's honor that. But what I also want to know as a facilitator, as we think about integrating this information about trauma, the trauma that our clients have experienced, or maybe that we've experienced, I want to ask you, what is it that you need for successful virtual learning? So, in an effort that I can really accommodate that need. Now, one of the things I'll go ahead and share with you from the very beginning is that we will be taking a few breaks throughout our time together. That 4 hours is a long time to just sit in front of a computer and try to absorb information. So, we will be taking some breaks. But tell me, how else can I ensure that as much as possible, I can facilitate a successful learning environment today? And any thoughts you have would be greatly appreciated so I can integrate those. So, for whoever said Pepsi and a candy bar, I wish we were in person because food is one of my love languages. And especially in a trauma training, I love providing snacks and caffeine. And so, if we were in person, there would be plenty of snacks and caffeine because I always like to say that calories don't count during a trauma training. But unfortunately, we're not in person and I can't provide you with that. So, seeing coffee, seeing shorter breaks than longer breaks, absolutely. I'll keep that in mind. I wish I could provide you new computers. I need one myself. It seems that mine isn't always working as well for this virtual landscape. And then I see how to navigate crisis with participants, and we'll get there in today's training. And I also want to make sure that you bring that up on the next slide as I ask you what you hope to learn. But let's see some of these other responses that are coming in that aren't quite scrolling for me here. Perfect. We'll continue to talk about those resources. Interactive activities. In addition to the Mentimeter, we will be utilizing not just the chat box, but also breakout rooms today. So that way you get an opportunity to speak because today is really more about workshopping and less about just hearing Sean talk. So one more question. That I have for you all, and as I already mentioned, thinking about what are some of those questions you may already have that I might be able to integrate in today's training, that if it's not already built into the content that we have, that I can be sure to integrate that. And I already saw one on the last slide of thinking about how is it that we can help clients navigate a crisis. And I think that's incredibly important, especially in your all's role. Are there any other questions that you have from the very beginning that I might be able to integrate throughout today's training? Perfect. So resources is a big one, and we'll be providing you with some resources for participants. And wanting to also understand that we need resources as professionals as well, right? Recognizing we saw how we're showing up this morning. Appropriate approaches, and absolutely thinking about what we can do. And we'll definitely be covering that in greater extent. And I loved a question of without bias. So making sure that we provide the appropriate resources and how do we be a support, ensuring that, yeah, your job isn't as a therapist, but thinking about what role can you play and how do you support an individual in that moment. Wonderful. Well, thank you so much for engaging in these starting off questions with me. That's going to be really helpful as we navigate. So let's move on into the initial content as we build our foundational knowledge of trauma. And so, what we're going to really be working on in this first piece of the training today is we're going to be working on shifting the question that too often when we see individuals displaying or expressing certain behaviors, that our first instinct is to say some form of the question or phrase, what's wrong with you? But what we have to work to do is we have to work to shift that question from what's wrong with you to what happened to you. And in the moment, what's continuing to happen? Now, I'll share with you all that my background is as a therapist. And as a therapist, between the hours of 8 to 5, I'm really great at shifting the question with those I have the privilege of serving, of shifting the question from what's wrong to what happened and what's continuing to happen. But you better believe that at 5:01, when I take off that therapist hat and I'm in my car driving home and someone cuts me off, I am definitely not asking, what happened to you? To be honest, I'm not even asking what's wrong with you. It's more of a declarative statement and a hand gesture, right? That it's not intuitive for us to change this question. But what we have to work to do is we have to work to shift the question in each and every single instance from what's wrong to what happened and what's continuing to happen. So, as we move throughout the first part of today's workshop, we're really going to be focusing on that, recognizing that we can't start to effectively intervene until that first step is taken. So, just thinking, when you hear this word trauma, and help me out and just put it in the chat box. Think about what's the very first thing that may come to mind for you as you hear this word trauma. Something bad, hurt, abuse, sadness, harmful, pain, fear, injury to a person's body or soul. Absolutely. Neglect, injury, physical or mental, generational curses, pain. And I love the way that you all are already starting to think about trauma. And that's really powerful because too often when I have these conversations, people only think about very specific types of events. But you all are thinking about hurt, pain, sadness, fear, injury to the soul or body, life changing. So, one of the things we have to immediately recognize is the traumatic event is only the start of the trauma process. That it doesn't just stop when the traumatic event ends, but that trauma has these really powerful consequences that have the potential to be lifelong. The other thing I want to fully recognize is also that trauma is individualized. That too often, when we think about trauma, when we think through our own lens, that we're really quick to label something as either being traumatic or not traumatic for someone through our own lived experience, through our own bias, our own frame of reference. But what we have to recognize is that trauma, first and foremost, is an individualized experience, meaning that what's traumatic for me may not be traumatic for you. And what's traumatic for you may not be traumatic for me. And so some of the things I want to recognize are items that have come up in the chat box of innocence being stripped away. Absolutely. And Mr. Wilson or Mrs. Wilson thinking about how we might engage with the world around us if our innocence has been stripped away. And Jamie noted being a Black man in America. So, talking about not being a Black man, but more importantly, talking about the racism that Black men, women, and children experience in our country, that it's not about one's race. It's about the racism, whether it be interpersonal, organizational, institutional, or systemic, that one experiences. And we'll continue to have those conversations. So rather than using a definition, what we use is a framework to help us conceptualize trauma. And we use this framework of the three E's: the traumatic event, the lived experience, and then the effects. So let's take a look at each of these three components here, beginning with the traumatic event. As we think about a traumatic event, we're thinking about any threat to safety, whether it's our physical safety or psychological safety. Also, wanting to recognize whether it's an actual threat or anything I may perceive as a threat based on my lived experiences. Now, that perceived threat can sometimes be really difficult to conceptualize. So, let me give an example to help us make this more tangible. Think about this for a moment on this cold, brisk morning as we move outside of our offices, as we move outside of our homes, just to have a change of scenery for a little bit, as we work to get some fresh air. And as we're out just getting that fresh air and that change of scenery, we just happen to hear a car backfire. Now, that instance, for some of us, we may be unfazed. For others of us, we may jump, scream, run away. We may dive to the ground. Now, what we have to recognize is that car backfiring isn't an actual threat, but we also have to realize the power of perceived threats based on our lived experience, that those perceived threats are just as real to the brain and body as any actual threat to our safety. Now, in the event of a car backfiring, we might be able to surmise how that was a perceived threat. But what happens if that perceived threat comes in the form of a smell, a taste, a touch, a sight, and not just a sound? Recognizing that while we may not understand that perceived threat, we still have to work to acknowledge how that perceived threat is just as real. Now, any threat to one's safety is pretty intuitive, but what's not always so intuitive And I see someone's having fun with the screen sharing option. What's not always so intuitive is that we're also talking about the lack withholding or control of those resources we need for our healthy development. And as we think about those resources, we want to understand that we have those needs for healthy development, whether they're material or relational needs, across the lifespan and not just as children. So help me identify, what are some of those material or relational needs we have across the lifespan that when there's a lack, withholding, or control of them, that it's also traumatic? Help me identify and name those needs from your perspective, from what you see day in and day out. And if you would, go ahead and name that in the chat box for me. So Lois shared with us love, shelter, nurturing, protection. Absolutely. Now, one of the things I do want to recognize is that not all shelter is created equal. That recognizing just because we may have a roof over our heads doesn't mean it's a safe roof. But recognizing when we don't have that love, that shelter, that nurturing protection, even as adults, that's traumatic. Needing that interpersonal interaction, which is becoming somewhat of a challenge during this time of COVID, recognizing how we need to remain physically distant, but we still need to remain socially connected. And that proves to be challenging during this time of COVID. Thinking about lack of access to proper medical services. Absolutely. How is it when I don't have access to the needed and necessary medical services? That's traumatic. And think about from your perspective, how does that impact then my ability to be successful in other realms of my life? Needing relationships of all forms. So thank you for sharing those thoughts with me. So that firsty, the traumatic event, we're looking at any threat to safety or the lack withholding control of those resources we need for healthy development, which then brings us to the next D, which is the lived experience and how I'm going to assign meaning to that traumatic event up above. And that'll be shaped by things like, has the individual previously experienced trauma? Wanting to recognize that trauma doesn't hide in just some deep, dark corner of my mind, but that any current threat to safety can pull forward those previous threats to safety. In addition to that, wanting to recognize what are those resources and capacities I come to the table with, things like my personal resilience, my ability to cope, ground, my self worth and self esteem, as well as what are those resources, material and relational, I have to buffer and protect me in the moment, that I have to support me through it. And based on that individualized lived experience, we can see very different effects. Now, what's so interesting is you can have two people experiencing the same exact event, but because of that individualized lived experience, we can see very different outcomes. We even see that within the same family, that when children experience the same event, that we can see different outcomes because of that individualized lived experience. So, one of the things I want to do is I want to look a little bit more closely at those different traumatic events. We know one of the ways we categorize trauma is into public versus private event trauma. And as we think about private event trauma, we're thinking about those things that may happen behind closed doors. but wanting to fully recognize and honor that when we're talking about behind closed doors, we're not just talking about behind the closed doors of home. So I want to ask you in the chat box to take a moment and help me name and create space. What are we talking about when we say private event trauma? Isolation. Absolutely. Someone sent me in a private message abuse, wanting to recognize absolutely all forms of abuse, whether it's physical, sexual, whether it's psychological or verbal, spiritual, financial, or even technological abuse. Wanting to recognize it's trauma that no one else sees. Anything that causes another person to feel manipulated, carjackings, self harm, and self injury. Absolutely. And thinking about even that self inflicted abuse, sometimes how we internalize that victimization we've experienced. So, when it comes to private event trauma, we know that too often there's an air of secrecy surrounding private event trauma because sometimes it's those things we don't want to openly talk about. It's those things that we fear if we name it, it may it may come to life. We also want to recognize that sometimes people may not disclose because there's a fear that they might not be believed, that someone will blame them for their own trauma. And also wanting to recognize, as some of you have noted, that in many cases of private event trauma, there may be force, coercion, or manipulation involved. Wanting to recognize that sometimes as children, we may not have that lived experience to recognize what's happening to us shouldn't be happening to us. So for many reasons, for far too many reasons, there's this air of secrecy surrounding trauma. And especially in cases where there's a power imbalance, wanting to recognize, wanting to recognize how there may be a sense of hopelessness that surfaces. Think about how we may feel hopeless, as someone noted, when the abuse is coming in the workplace from upper management. How we may feel powerless in that experience because of that power imbalance. Now, as we shift gears and we think about public event trauma, we think about those things that happen out in the open: car accidents, natural disasters, even public acts of crime and victimization. Now, because they're happening out in the open and there's a shared experience, we see that there's not that same judgment attached to public event trauma as we see in private event trauma, at least not initially. Now, what we do know is that over time, there may become layers that get added to that experience of trauma. Think about this. Let's say if my house burns down, in the immediate aftermath, my friends, my family, my community rally around me. But what happens 3 months from now, or 6 months from now, or even a year from now, if I haven't moved on like others think I should? Too often I get messages like, Sean, that happened so long ago. Sean, just get over it. Sean, that happens to so many other people and they're just fine. Sean, man up and take care of your family. That over time, we do see how judgment gets attached to the trauma and adds layers to that experience of the trauma. Thinking about how easy is it to move forward when the messages we're getting are just get over it. Now, in public event trauma, because there are forces beyond our control, because I couldn't stop that car accident, that natural disaster, even that person from holding up the convenience store, we want to recognize that because of those forces beyond our control, there's a sense of helplessness that arises, that I have no control over my environment. And just as we see in private event trauma, a profound sense of loss, as someone named for us earlier, someone named the loss of innocence that we have to feel like we're navigating life through, thinking about loss of self worth, self esteem, education, worth, freedom, and how that may not just be a short term impact, but a lifelong impact. I do want to go back for just a moment, and some of our participants have shared some really powerful things in the chat box. Brianna shared with us that as we think about private event trauma, understanding the experience of mental illness or living with mental illness, that I may be living with severe persistent mental illness and I have to do so in silence because I worry that others may judge me. That during this heightened time of stress and anxiety, we know that individuals who have never had experiences of depression are now experiencing the depression that comes with this heightened time of stress and anxiety, and how depression is becoming really normal during this time. But even though we understand it's becoming normal, how is it that individuals may be struggling with that depression and not feeling empowered or like they have the ability to name that? Wanting to also recognize that as someone mentioned, because of that past trauma, that how holidays, as we come into the holiday season, can be really difficult and triggering periods of time for some individuals. And wanting to fully name that we can see a lot of hyper or hypoarousal, which we'll talk about a little bit later, and how those triggers come to be. But wanting to fully just name that as we're moving into the holiday season, how that can be really a difficult time for many people, and how we're putting then increased restrictions of even for some people who may not typically have that difficulty with the holidays, how in an effort to stay safe and keep others safe, they may not be able to engage in the holidays in a meaningful way like they typically could. So, and then just to answer a question that's come up, lack of judgment, what we're talking about is because in public event trauma, it happens out in the open, that when something like a car accident happens and we know about it, we don't have necessarily that judgment about the trauma as we hear too often with things like abuse in the home. Too often when working with families, and then with even working with workplaces, when we talk about abuse that may happen in the home, a lot of times I hear reactions like, well, what is the individual doing that's causing others to abuse them? That we automatically have this judgment attached. But no one has that judgment attached to something like a car accident, a natural disaster, or even a public act of crime and victimization. So, moving along, even though we talk about public event trauma, one of the things that too often gets overlooked and goes unnamed is community trauma. And we're going to spend a lot of time talking about the power of community trauma. And so we know that when we're thinking about community trauma, it's just not public trauma, but we're talking about also other specific forms of trauma that have too often persisted in silence. So, whether it be a combination of experiences, whether it even be maybe an event that impacts just a few but has broader implications, and sometimes even recognizing how there may be a ripple effect may not be something I directly experience, but there's a ripple effect, that ripple impact that impacts me even when I didn't experience it. So, anytime there's a threat to our safety, whether it's a public event, private event, or community event, whether it's our physical or psychological safety, an actual or perceived threat, one of the things we have to recognize is that we have this stress response system that kicks into gear to keep our bodies safe. That this stress response system is actually something that we're born with. It's already well developed when we're born. And that oftentimes we refer to the stress response system as our fight, flight, freeze response. Now, what I find is that most people have heard of fight and flight, but we don't often enough talk about that freeze response. So let me just give you an example of all of these. Let's say that because Sean needs to just get away and needs a break and wants to get just out of his house, Sean decides to go camping, which is really funny because I hate the outdoors. So I've got to be pretty desperate if I'm going to go to nature and go camping, right? But let's say Sean decides to go camping. And of course, what camping experiences is complete without roasting marshmallows and making s'mores, right? Maybe I'm the only food lover in the group, but for me, no camping experience is complete without the s'mores. So as I'm collecting firewood to roast the most perfect marshmallow, I just happen upon a bear. In that instance, my stress response automatically activates to keep my body safe. And if my stress response determines, hey, Sean, you got to fight this bear to stay safe, all of a sudden adrenaline and cortisol, norepinephrine are coursing through my body to help me fight this bear, to help me fight harder than I've ever fought before. Now, if that stress response determines, hey, Sean, you're a little guy and there's no way you can fight this bear, you got to run. Those same hormones are helping me to run faster than I've ever run before. Now, if that stress response system determines, hey, Sean, you can't fight this bear and you can't outrun this bear, you got to freeze. All of a sudden, my heart rate slows, my breathing slows. I may fall to the ground playing dead, and it feels like I'm stuck in place. Now, what we have to recognize is that these stress responses are instantaneous and automatic. That it's not my rational brain weighing pros and cons, thinking, should I try to fight the bear or should I try to run or should I play dead? Because if my rational brain kicked into gear, I'd already be in danger. I'd already be hurt. This stress response system is an instantaneous, automatic survival response to keep the body safe. Now, let me ask you this. Out of these three responses, which one do you think is the most common in private event trauma? Freeze. Absolutely. Now we know that fight and flight still happen, but freeze is the most common response. And too often we hear responses like, why didn't you just run? Why didn't you kick, scream, yell, punch, fight? Why didn't you come tell me, Sean, a trusted colleague, coworker, a trusted supervisor? And what are we doing in those instances? We're blaming, shaming, judging, even re-traumatizing. And we know absolutely, Christina, that society is too quick to blame victims for their own trauma. Absolutely. So, what we have to recognize is that in hindsight, it's easy to say, oh, if someone had tried that with me, I would have fought them and I would have hurt them, right? But what we have to recognize is we don't actually know how we would respond until we're faced with that same exact situation. So a few more slides before we take our first break. So moving forward, we're not going to talk about trauma as if it were to happen only in isolation. We're going to talk about this notion of chronic trauma, recognizing that well, when we hear about trauma, it's really easy for us to think about it in terms of this is the only traumatic event that person has ever experienced. But what we far too often know is that individuals have experienced chronic trauma, and that one traumatic event I know about is actually part of a much larger narrative or history of trauma. So there are two primary reasons why we talk about chronic trauma. Reason number one, we know that for 26% of children in today's world, they'll experience their first traumatic event prior to the age of 4. Not their last, not their only, but their first. We also know that experiencing just one traumatic event in childhood makes an individual vulnerable to experiencing trauma across the lifespan. So, thinking about the adults we may work with, what might be their experience of trauma? So, when we're talking about chronic trauma, we're talking about one or multiple of these three scenarios. We're talking about experiencing the same event repeatedly, or even experiencing multiple different traumatic events, recognizing that even from different types of trauma, there's a compounding effect, or the experience of that environmental or community trauma. Now, for far too long, the notion has been that when it comes to trauma is just this psychological experience, that the impact of trauma is just psychological. But the science teaches us a very different story, that regardless of what type of trauma it is, that trauma's impact is incredibly powerful. Trauma has the ability to impact the developing brain architecture, has chronic consequences on our physical health, and impacts how we engage with the world around us. That in short, trauma is a whole body, whole being experience. So, with that being said, we know that more than 50% of the population has experienced at least one traumatic event. 50%. So, I want to ask you, from your lens, from your lane of what you do professionally, what would you say is the prevalence in your community? Would you say it's lower than that 50%? Would you say it's on par with that 50%? Or would you say it's higher than that 50%? Put just lower, equal, or higher in the chat box for me. Okay, I was trying to count, but you all started responding so quickly that I lost count. But it looks like every single individual who responded in the chat box said higher. So, with that recognition that the prevalence is higher in our community, how is it that we work to continuously change the question from what's wrong to what happened? So, I want to share just a few more statistics with you all. We know that children who go through the foster care system have diagnosable rates of PTSD twice that of veterans who served during wartime. Now, let me be very clear. This statistic is in no way designed to diminish the experience of our veterans who so selflessly serve our country. But what we know is that for far too long, we thought that only two groups of people could develop PTSD: those who had experienced war and those who were survivors of sexual assault. But what that means is we were missing trauma all around us for far too long. The next statistic I have here is that nearly 40% of adolescents have directly witnessed an act of violence. By directly witness, we mean live and in person. But I want to share with you all that I put in a dated statistic. This statistic is from 1998. So thinking about in the year 2020, what might that look like? So now what we've done is we've worked to develop a framework of what is trauma, started to talk about the various forms and even talked about chronic trauma and some prevalence. What we're going to do now is we're going to take a break before we move on to the impact of trauma. And so the time is right now 10:13. And what I want to encourage you to do is meet those biological needs, whatever that they may be in this moment, so you can come back and continue to learn. But I want to ask you that when we come back and in our break time specifically, please do not check your work email. Take a few moments to actually meet those biological needs so we can come back and finish our important discussion and workshop today. I'll see you back here at 10:20. Welcome back. I hope that you were all able to take those few minutes to just take good care of yourselves as we continue on. I know that talking about trauma can be fairly heavy, so please ensure that as we engage in those breaks today that you're taking excellent care of yourselves. So as we move along, now that we've had those discussions about what is trauma, I want to move into then what is some of the impact of it. And to start this conversation, we're going to look at some research that actually, at this point, is a little bit dated, but still communicates a really powerful message. And to do that, we're going to look at the ACEs study, or the Adverse Childhood Experiences study. Now, many of you are probably already familiar with this study, and so I'm not going to go into too much detail, but just give a little bit of background. So, back in 1995, Kaiser Permanente and the CDC joined efforts to ask two key questions. Number one, what's the prevalence of childhood trauma? And number two, what's the impact of childhood trauma on adults? So, for the purposes of this research study, they enrolled over 17,000 individuals, asked them about their childhood trauma, and then overlaid their complete medical history. Now, before we get into the findings, two things I want to highlight. Number one is that for the purposes of this research study, we only looked at 10 types of childhood trauma. We looked at child abuse, physical, psychological, and sexual. We looked at child neglect, physical and psychological. And then we looked at trauma in the household environment, which consisted of parental divorce or separation, substance use in the home, anyone in the home living with mental illness or expressing suicidal ideation, violence towards mom or stepmom, and finally, incarceration of a family member. Now, what we want to recognize is that if we put our heads together, we can double, even triple this list just within a matter of minutes, right? That this list of childhood traumas is by no means exhaustive. So, recognizing that as we look at the results, we're only looking at a limited list of 10 different types of traumas. The other thing I want to point out is the study demographics. And as I list off these demographics, I want you to think about who was included in the study and who was excluded from the study. So, as we look at the study demographics, we're talking about 75% Caucasian, 39% had a college degree or higher. Everyone enrolled in the study was employed at the time of the study. Everyone in the study had private health insurance, and the median family income back in 1995 was about $55,000 per household, which today translates to about $95,000. So think for a moment how that may or may not align with the population that you serve. I see some heads just shaking, right? Doesn't align at all. Now, thinking about those two things, the study demographic and that we were only looking at a limited list of 10 types of trauma, what we found out was incredibly eye-opening. What we found out with this very affluent population was that two-thirds had experienced at least one type of trauma in childhood. And remember, as I shared earlier, that experiencing just one traumatic event in childhood can make an individual vulnerable to experiencing trauma across the lifespan. So the studies help dispel that myth that trauma actually does not discriminate, that we're all vulnerable to experiencing trauma. In addition to that, the study helped to really bust some myths of, oh, you know what, kids are just so young when they experience that trauma, they won't remember that, or kids are so resilient they'll get over it. But what the study actually showed us is that kids just don't forget and they don't just get over it, because the study showed how childhood trauma correlates with things like adult diabetes, cardiovascular disease, ischemic heart disease, certain types of cancer. And for individuals who experience 6 or more types of trauma in childhood, we can see up to a 20-year reduction in life expectancy. That childhood trauma is so powerful, it can literally take years off someone's life without intervention. And that really helped to wake us up to trauma's true power. Now, in the original ACE study, what we looked at were just interpersonal experiences of trauma. But today, in 2020, we have to utilize a different framework to really conceptualize and understand trauma. And today, we use the framework of the pair of ACEs. So, recognizing not just adverse childhood experiences, but also recognizing adverse community environments, recognizing the power of community trauma. And the reason we have to recognize community trauma is twofold. Number one, we have to recognize that experiencing community trauma isn't a discrete experience of trauma. That unlike other forms of trauma, there's no start and stopping point, that too often it's a persistent 24/7 experience of the trauma. In addition to that, we have to recognize how experiencing any one of these community traumas makes an individual vulnerable to those interpersonal experiences of trauma. So let me give you an example. Think about this. Think about how experiencing poverty makes an individual then more vulnerable to experiencing things like homelessness, substance use, incarceration, domestic violence. So, in this pair of ACEs model, we understand that experiencing community trauma is really like toxins in our soil. That community trauma prevents our community from growing alive and well, from reaching its full potential. And that's the power of community trauma. It's like a toxin in our soil. Now, from a national landscape, what they've identified as those adverse community environments or community traumas is poverty, discrimination, community disruption, lack of opportunity, economic mobility, and social capital, poor housing quality and affordability, and community violence. Now, what we're going to do is we're going to engage in our first breakout room where we're going to workshop and we're going to ask this question of what are those toxins, those specific toxins in our soil we have to recognize and specifically name that impact our community, that may even impact the clients I have the privilege of serving. So, what I'm going to do now at this point is I'm going to move you all into breakout rooms where you're going to engage in this conversation of what are the toxins in our soil. And so, what I'm going to encourage you to do is have those robust conversations, because we're going to come back and we're going to report out. So, what you'll see here is you'll see that you've been invited to join a breakout room. And all you have to do on your screen is click join room to have that conversation. And I'll welcome you back here in about 5 to 7 minutes. Please let Brittany or I know if you don't see that invitation to join a breakout room on your screen, and we'll work with you to make sure that you're able to join one of those breakout rooms. But all you'll need to do is click join the room on your screen. Welcome back. So I hope that you all had an opportunity to engage in some rich discussions in your breakout groups. And I just want to take a few moments to hear what are some of those toxins that you all named in the soil. And I
Hey,
want to,
Sean.
yes.
Hey, I'm sorry to interrupt, but I was in group 8 and someone was speaking and was in the middle of what they were saying, and I would really like to listen to what they had to say because they were cut off and it was very, very important, and I was feeling what she was saying.
Okay. Samantha, do you know who that was so we can potentially invite them to share with the larger group?
I did not, because she started talking before I could even filter through to see who was speaking, and then it cut off.
So if you were in group 8 and you were sharing something rich and powerful as the rooms were closing, I want to welcome you to share.
Okay, thank you. My name is Marilyn Parker, and I was sharing uh, two things. I think mental illness is one, because people really are not aware of exactly what mental illness looks like. So, mental illness begins to become um, tolerated, just who I am. And so they don't know they have mental illness, and that can be corrected. And the next one is those that face child support. A lot of times they feel abused. So when they, receive a paycheck where they have $300, and for whatever reason, when they get that, amount of money taken out and they don't have enough money to live, and to have gas money to eat and to pay their rent, they feel abused and they feel like there's no one that cares, no one that understands, and just the different treatment that maybe they even imposed upon themselves, but they can feel like abuse when you go to work every week and you're homeless because you couldn't catch up on your rent, but yet you pay the government. And so you begin to feel abused. So I don't know what category we would put that in, but I see a lot of people that really are hopeless, downtrodden, all of that. And the first thing you have to do is build them back up before you can even service them.
So Marilyn, I want you to bring that last part into focus again as we move through our training. Um, as we move through our training, we're really going to bring that back to the surface of what is it we need to recognize in our role as we work to change the question, as we work to support individuals in gaining successful employment. So thank you. I want to talk a little bit about what Marilyn mentioned because I think it's so crucial to highlight about the mental illness, about, you know, we don't oftentimes know what it is or what it looks like. Sometimes we feel isolated in those experiences. Sometimes, there's stigma surrounding accessing supports, whether it's this gendered stigma of men shouldn't be accessing those, or even cultural stigmas. And wanting to also recognize that sometimes the resources in our community haven't been trusted resources. So there's not always what feels like accessible or appropriate resources. So, absolutely, with any one of those toxins we identify, we can go through and we can nuance it even more. So, thank you so much for sharing with us, Marilyn. And then it sounds like that was a similar conversation that folks were wanting to have. I want to ask, what are some of the other toxins that you all identified?
And hi, Sean. How are you?
Hi, good to see you.
Good to see you. So our group mentioned mental illness as well. In addition to, we spoke about alcoholism and the genetic experience. We listed abuse, the cycle of abuse, and for example, we had like from your parents, we talked about addiction. We talk about addiction. There's so many different, variations of addiction. and the toxic within the family member, right? So how family members can be very toxic. Societal issues, and just breaking the generational habits. We talked about how in some generations being institutionalized, just breaking that barrier. And those were a list of things that our group listed.
Yeah, it sounds like you all had a really rich discussion in your group as well. And thinking about, when it comes to addiction, maybe it's being surrounded by addiction. Maybe it's, that early exposure, even that in utero exposure to addiction. Thinking about what are the resources we have in our community and recognizing that not all resources are available all over our greater state, right? Because we know we have individuals from across the state joining us. So recognizing those resources aren't available and also
Right.
recognizing they're not always culturally appropriate. And I see a lot of people named poverty. And so I want to just go ahead and name that, especially as you mentioned, that transgenerational cycle.
Right.
We know that children who grow up in poverty are 7 times more likely to raise their own children in poverty. So, how is it we start to understand the transgenerational process of trauma? So, Cortina, does this sound better? I raised up the sensitivity on my microphone, so hopefully you can hear me a little bit better now. But absolutely, how is it that we
Take his
start?
voice with me.
I'm sorry, Kiana, was that you?
Nothing, sorry.
So, wanting to recognize that transgenerational cycle of poverty and also how trauma becomes perpetuated from one generation to the next. Tom named something else that's really important is that sometimes there's this notion of just get over it, pull yourself up by your bootstraps, or I was able to do it, why can't you do it? And so recognizing how is it that we're adding layers to the trauma, talking about lack of family support, about how when our families have experienced trauma, how is it that they're able to support others in the household who have experienced trauma? Gregory mentioned literacy, so let's take a moment to talk also about educational opportunity. That depending on your geographic location, your very specific geographic location, means the educational opportunity our children have access to, something that our children have zero control over, then dictates their educational opportunity. As we think about literacy and supporting literacy, as we think about sometimes even in our service delivery, we make certain assumptions that everyone has the same level of literacy, right? Absolutely. Family support, substance use, and wanting to recognize that substance use doesn't just impact the individual using the substance, right? It impacts the family, it impacts the community. Also, Rebecca noted unstable housing as well as housing discrimination. If I don't have a safe, consistent roof over my head, how's that going to impact my ability to show up on the job? If I can't even access safe housing, around across the country, we haven't heard too many stories of that yet in our region specifically, but across the country, we're hearing how landlords are now using loopholes and laws to to displace tenants who didn't have the ability to pay. Thinking about, is that going to become more of an issue not just across our country but in our region specifically, and understanding how can we do things like show up at work as a productive employee, when we're experiencing other forms of trauma. And then Ms. Jackson mentioned clients' inability to read and comprehend documents and employment applications. And how does that limit opportunities, regardless of how good of a worker they may be? That community violence that Renee mentioned. Also, Rebecca mentioned undiagnosed adult learning disabilities. We know that, our schools weren't equipped with the resources that some of them have now. Not all of them, but some of them, to really identify those learning disabilities early on. And think about some of the messages that those adults who are living with a learning disability that's never been diagnosed, some of the messages they've received across their lifespan of you're stupid, you're no good, you're never going to amount to anything, what's wrong with you? That takes a toll and an impact. Lack of basic needs. And then, Miss Rhodes, if you're continuing to have difficulty with the sound, please let us know. You can private message either me or Brittany. And understanding also, really, the power of that vocational rehab and how our vocational rehab and our workforce development can play such a crucial role. And then digital divide, huge technology gaps in impoverished communities as well as in rural communities, those who can't get their medications, those who have to constantly have to weigh, do I put food on the table or do I pay for my medication? Okay. So, what we want to recognize in those rich discussions that you all had in your groups is those toxins in the soil. And when we start to recognize and name those toxins in our soil, how can we understand those? How can we work to then change the question to better support the clients we have the privilege and the honor of serving? So, thank you all for having those really powerful conversations in your groups. We're going to utilize those groups 2 more times before the conclusion of our workshop today. So please make sure that you engage in those valuable conversations. So we also want to work to talk about the layers of trauma. As Ms. Strong mentions, the layered impacts. So right on time, wanting to recognize that too often when we talk about interpersonal trauma, when we know someone's experiencing homelessness or substance use or domestic violence in the home, it's easier for us to change the question. But too often what happens is we don't just naturally change the question given the numerous toxins in the soil that exist. We don't just automatically change that question. And wanting to recognize that you all named many toxins and there are many toxins in the soil, right? Wanting to also recognize how community trauma didn't just arise today. Wanting to understand how community trauma is the presence, the living presence of historical trauma, whether it be that national narrative or recognizing how each community has their own narrative of historical trauma that we have to recognize as present. And at the core of this, fueling all of these layers, we have to understand systemic oppression and how systemic oppression is trauma. So, naming how is racism a form of trauma, whether it's interpersonal or systemic? How is sexism a form of trauma? How is ableism, classism, heterosexism trauma? So earlier we mentioned that trauma doesn't discriminate, and that's true. What we also have to recognize, though, is based on one's marginalized or multiple marginalized identities, that someone is vulnerable to increased experiences of trauma. So we have to recognize, how is that oppression in its various forms? Trauma. And how is it, as a result of that oppression, we're vulnerable then to increased experiences of trauma? So we have to start to identify all of the layers rather than just working on the surface, but really identifying what's fueling trauma in our communities as well. And what I also want to recognize is that there may be additional toxins in the soil we may not have named, but it doesn't mean that they're any less real in our communities. So let's take a few minutes then to talk about trauma's impact on the brain. And we're not going to get too far into the neuroscience, but we really just want to set the stage for talking about just how powerful trauma is. So to do this, we're going to start off by just noting a little bit about typical brain development. And as we look at typical brain development, we know that at birth, the brain's about 25% the size and volume of an adult's brain. But what's so interesting is that an infant's brain and an adult's brain have the same number of brain cells, which is about 86 billion brain cells. And so, what we want to recognize over time, it's not that we grow brain cells, but in part, what helps to shape the size and volume of the brain is the number of connections that those brain cells make, or what we refer to as the synaptic density that's fostered amongst the neurons. We also want to recognize, ooh, we also want to recognize that the brain develops from the lower part to the upper part. That at birth, our brainstem and our lower brain, this comprising our survival brain, is really well developed. And that's crucial because we know how to do things like regulate our body temperature, digest our food, communicate when we have any sort of need. Which also means that our stress response, that fight, flight, freeze response, is really well developed when we're already born. And so what happens is that we develop from the survival brain up to the higher parts of the brain. Now, what we know is that the brain doesn't fully finish developing until about 25 years old. And the reason this becomes really crucial for us to understand is because of what these higher regions of the brain actually control. So, our prefrontal cortex, which doesn't develop until on average about 25, controls things like my ability to delay gratification, my ability to predict consequences, my ability to process analytical information, my ability to regulate my emotions and behaviors. It's my executive governor, my moral compass. It's even where my words are located. So, this really powerful part of the brain doesn't even fully develop until about age 25, till well into adulthood. So now let's look a little bit more closely at this prefrontal cortex, this part of the brain that doesn't develop until early adulthood. So we know that in looking at it and in looking at three different developmental phases, recognizing that we're talking about the same number of brain cells, but the difference you see across these three different phases is the connections fostered amongst these brain cells, that synaptic density. So at birth, we see the brain is really this clean slate, and the brain's a sponge. It does a great job at learning. And so as we move into 6 years old, we see all of these various connections that the brain makes. And think about what's going on for a 6-year-old, that they're in school, they're making friends, they're exploring the world around them, hopefully. They're asking that question over and over and over again of why, why? I have a 6-year-old nephew, and because of how his brain's working and operating, you can literally feel the heat radiating off of his head, right? And if you feel above my head, not so much heat radiating anymore, right? Now, then, that brings us to our first really important lesson about the brain is that those connections that fire together, they wire together in the brain. We often think about how practice makes perfect, but really what's happening in the brain is as those connections fire, they wire. So think about something like this, like catching a ball. The very first time you had to catch a ball. If you were like me, you probably weren't so successful the very first time. And think about what goes into that. You have to use this thing called hand-eye coordination. You've literally got an object that's flying at you. And then in perfect harmony, you've got to engage those fine and gross motor skills. Well, the more we practice, it becomes easier, right? Because those connections are firing and wiring in the brain. And now, as we move into adolescence, this heightened process of pruning begins, that those connections we're not using, we start to lose, to allocate resources to other parts of the brain. Now, I shared with you all that the brain is awesome at learning. But unfortunately, the brain's not so great at deciphering what we want it to learn and what we don't want it to learn. So, in the event of trauma and neglect, firing and wiring are happening. But that firing and wiring isn't happening in the prefrontal cortex that does all those really powerful and analytical things. But the part of the brain where that firing and wiring is happening is in my survival brain. That part of the brain that's already well developed at birth. That trauma is so incredibly powerful, it rewires the brain for safety and survival. So, based on research done right here in the state of Missouri, we can see for children who have experienced trauma versus their peers who haven't, a smaller and reduced brain size of that prefrontal cortex. And we see heightened wiring and even an enlarged amygdala. That trauma and neglect literally rewires the brain for safety and survival. So the reason we spend time as we're talking about workforce development, thinking about the brain, is having to recognize how has our past experiences of trauma really wired our brains for safety and survival. And it can result in things like memory problems. That if I give someone 2, 3, 4 instructions at a time, they may be so hyper focused on trying to remember the first one that they may only remember the first one, or they may remember none of them. So, what may look like defiance, disrespect, not following instructions, is actually not having the cognitive capacity to remember everything you said, because trauma literally rewires the brain for safety and survival. Attention difficulty or focusing on a single task at hand. Even something we too often unfortunately see is that we have someone who's chronologically 30, 35, 40 in front of us. And when we give an instruction or when we say something, all of a sudden, even though they're 30, 35, 40, we have a presenting 10-year-old in front of us, right? That inability to regulate effectively my emotions and behaviors. And this becomes crucial for us to understand in workforce development how trauma has impacted the brain. Now, in sharing all this information, we're not wanting to be defeatist because what we know is that it's never too late to intervene. It's never too late to intervene. And with intervention, we can help to build that synaptic density in the prefrontal cortex. But we have to have this awareness of trauma and work to change the question if we're going to do that. So, the other thing we want to recognize is how traumatic events imprint differently in the brain. You may not remember what you had for dinner 3 weeks ago, and that's normal and natural. But if I asked you, think about the last time you were almost in a car accident, even though that may have been much more than 3 weeks ago, because of the way trauma imprints in the brain, it's really quick for our brain to be able to recall. And anytime our brain recalls that, it activates that fight, flight, freeze response. And as we're thinking about that fight, flight, freeze response, wanting to recognize this same response, that's designed to keep my body safe, to protect my body, over time can become toxic to my own body. This response was designed to activate when we occasionally see that bear in the woods. And then once we're safe, it deactivates. But what happens if there are multiple bears in our lives? This stress response system that's designed to only sporadically activate is now activating frequently and for prolonged periods of time. And this same stress response system actually starts to become toxic to my own body. So we have to recognize that anytime that fight, flight, freeze response activates, there's a spike in my blood sugar to help me be able to fight, flee, or freeze. But that constant and frequent spike in my blood sugar can lead to the onset of diabetes, regardless of how well I eat, of how much I exercise. That all of these processes start to become toxic to my own body. So let's start. Let's start to put all this information together. And to do that, we're going to look at the window of stress tolerance. And what we have to recognize is for each of us as individuals, our window of stress tolerance are different sizes, right? But in an ideal world, we would all work and operate within our window of stress tolerance. That whenever I become stressed out, I'm able to self soothe and self regulate. But for individuals who experience chronic trauma, anytime there's an activating event, whether it's a trigger of our past trauma, whether it's a new traumatic event, whether we just become overwhelmed, we don't work like this smooth, curvy line. Instead, we work and operate like this red line, where I may shoot above that window of stress tolerance into that space of hyperarousal, where we see things like anger, rage, mania. And that's that activation of my fight and flight response. Or We may see someone shoot below the window stress tolerance into the space of hypoarousal, where we see things like apathy, disconnection, isolation, depression. And this is that activation of my freeze response. Or I may bounce back and forth between the two. Now, what we have to understand is that this red line that we see here is a normal response as a result of those abnormal traumatic experiences. This red line starts to activate at lower and lower thresholds in a desperate attempt to keep the body from experiencing yet another traumatic event. So, what we're going to do is we're going to talk much more about hyper and hypoarousal when we return from our next short break, to think about how this may show up in our different spaces for the clients we serve. But what we're going to do is we're going to take a break now until 11:20. And again, I'm going to encourage you to meet those biological needs so we can come back and talk about hyper and hypoarousal to ensure that when we return, we're in our own windows of stress tolerance to learn this information. Again, I'm going to challenge you not to do work while we're taking our break. I'll see you back here shortly. Welcome back. I hope that you all had that great opportunity to meet your biological needs as we continue to talk about the window of stress tolerance. And and one of the things that makes this so crucial to understand is that we see expressions of fight, flight, and freeze all the time. But too often, us recognizing them as fight, flight, and freeze expressions doesn't happen as it should. So, let me share a story with you all. So, Sean, during non COVID times, loves going to Cardinals games. And if you're not from the St. Louis area, I'm sorry, but you're missing out not being a Cardinals fan. So during non-COVID times, I love getting to go and watch the Cardinals play live and in person. There's nothing like that experience. Now, getting to go to a Cardinals game combines not just my love of baseball, but it also combines my second favorite pastime, which as a therapist is people watching. So anytime I get the opportunity to go to a baseball game, I get there early, I grab my beer, and I find the perfect spot for people watching. And without fail, I see the same situation play over 3 or 4 times before the game has even started. That as people are in this crowded space passing each other, one person may accidentally nudge another person's shoulder in passing, and all of a sudden the other person turns around and they are ready to fight. Now it's really easy to say that's such a disproportionate response to accidentally getting your shoulder brushed. What is wrong with you that you're wanting to fight at a Cardinals game? But the science of trauma teaches us something different. As a result of experiencing that chronic trauma and the brain rewiring for safety and survival, this stress response, that red line, activates at lower and lower thresholds in a desperate attempt to keep the body from experiencing yet another trauma. So that slight brush of the shoulder sends a message to my amygdala, our stress response's alarm signal that says, Sean, you're in danger, and right now you got to fight to stay safe. So that person turns around and they're ready to fight. So, what we have to work to do is we have to work to name all the different ways we see hyper and hypoarousal expressed. How is it that we constantly see responses of fight, flight, and freeze, but we don't name them as a trauma response? We say, what's wrong with you? So, what I want to do is I want to challenge you all to unmute or to type in the chat box, how are all the different ways, either professionally or personally, you see fight, flight, and freeze show up so we can start to make that connection to change the question because the body's communicating, I'm unsafe right now. So we can really intervene. Joy, I see you say driving down the road, and are you talking about my road rage or someone else's road rage here? But absolutely, road rage. Thanks, Joy. Road rage, absolutely. Just asking someone about their drug use because they're worried about how you might use that information or worried that they may have to defend it or that you may not understand, that they go into that hyper or hypoarousal. Rebecca, technology frustration. Absolutely. And let me tell you, when I experience that technology frustration, my freeze response kicks in, right? Members challenging your decisions, asking about childcare or about the welfare of your children, engaging in a physical altercation, an overdose, an unresponsive offender, someone who you're talking to and they're physically in front of you, but mentally they're someplace else, right? That fighting, that yelling at the receptionist, that having to wait, maybe even being told, no, you're 10 minutes past your appointment time, so we're going to have to reschedule you. Thinking about things like yelling, kicking, screaming, putting a hoodie over our head to make ourselves unseen. What can look like apathy of why aren't you taking these steps to support yourself? Of it seems like I can give someone a step-by-step roadmap and they're not taking any steps themselves. Fear of change, absolutely, whether it's good or bad, because recognizing with change comes the unknown. And with the unknown comes unpredictability and fear can escalate, right? Whether it's something like starting a new job or moving to a new city, ending a relationship, absolutely. Advising someone that their program eligibility has changed and that assistance that they're used to getting, they may not get because all of a sudden it means their needs are not going to be met and not knowing how those needs will get met. Other ways you see hyper and hypoarousal. Being out of your comfort zone. Absolutely. That can easily activate that stress response system. Now, here's often the thing. As helping professionals, we want to take advantage of teachable moments, right? That we want to help people explore new and different skills. But what we have to recognize is that when I'm presenting in the moment in hyperarousal or in hypoarousal, it means I'm in my survival brain. And so, too often, when we want to engage in that teachable moment, we try to talk to people, we try to help people understand while they're still in that survival brain. When really, if we want to make it a teachable moment, we have to help people first get back into their window of stress tolerance. Because it's only when I'm in my window of stress tolerance that I'm here in this analytical part of the brain, that part of the brain that can do things like predict consequences, delay gratification, regulate my emotions and behaviors. And just a few other items that were mentioned, recognizing COVID-19, being around unfamiliar people or outside of our regular routine, absolutely. Hearing of domestic violence and not knowing what to do. So recognizing all of the many ways we see this, and we have to start to change that question. So we're going to finish up by talking about how we may see this present across different developmental stages, and then start to go into what we can do. And then we're going to start to brainstorm in workforce development. What are those special considerations we have to be able to integrate in order to support individuals? So as we think about trauma and development, the one thing I want to go ahead and name is that in these lists, I've provided lists on the following slides of ways that we can see trauma present across the lifespan. but wanting to recognize that each of these symptoms I may list, not a single one of them is stage limited or stage bound, meaning that just because I move from childhood to adolescence or adolescence to adulthood doesn't mean that those symptoms just automatically disappear. And also wanting to recognize how is it that each of these symptoms is really an expression of hyper or hypoarousal. So, as we see the impact on young children, recognizing that we can see these symptoms still in adulthood, that connecting the dots back to trauma. And now I'm not going to read this list for you. And again, this list is by no means exhaustive, but let me give you one example of how the dots connect back to trauma. So, if you think about something like sleep difficulties, when we hear about someone having sleep difficulties, we don't often think trauma. But let's start to think about this a little bit differently. So, imagine this. In order for someone to fall asleep, they've got to allow their body to be vulnerable while they check out for anywhere from 6 to 10 hours, which means in order to allow my body to be vulnerable, I've got to perceive my environment as being safe, meaning what's happening inside the home as well as what's happening outside the home. Now, if I don't perceive my environment as being safe, I'm not going to get that restful, restorative sleep, which means that I may crash from exhaustion when my body finally gives up on me. Or it means I may fall asleep at inappropriate times, including maybe while you're sharing with me how to ace the interview, including when you're helping me build the skill sets I need to be successful in a career path. Switching gears and looking at adolescence, we can see a lot of different ways that the trauma may be expressed. Those expressions of hyper and hypoarousal. And we also know that a lot's going on during adolescence as we try to establish autonomy from our caregivers, as we try to fit into our environments, figure out who we are. While meanwhile, this process of puberty is taking place. So some of these things may look like typical adolescence, but we've got to see when we see the extreme behaviors that we start to think trauma. So, for instance, as you hear about difficulty with authority, redirection, or criticism, that may sound like any adolescent everywhere. But when I see heightened difficulty with authority, redirection, or criticism, I have to start to wonder what's fired together and wired together in the brain. Because maybe what's fired together and wired together is that those authority figures who should be protecting me, watching out for me, have my best interest at heart, only cause me hurt, pain, or fear. So anytime any authority figure or anyone I perceive to have authority provides that redirection, criticism, the only thing that's really firing for me is that hurt, pain, and fear. And how often do we see that, not just in adolescence, but also in adulthood? Now, as we switch gears and look at adults, oftentimes what we see is a lot of the same expressions and behaviors, but suddenly in adulthood, we think that people should know better and do better, that the same expressions all of a sudden result in much greater consequences. So imagine this. If a third grader curses out their boss, their teacher, what might happen? There may be a call home to mom and dad, maybe, some sort of apology letter that has to be written, depending on choice words, maybe having to spend a few days away from the class. But ultimately, that third grader is back in the classroom. Now, let me ask this. What happens to me as an adult if I curse out my boss? Is it a call home to mom and dad? Is it an apology letter that gets written? Is it a few day vacation? No, all of a sudden, Sean's fired for creating a hostile work environment and unprofessional conduct in the workplace, right? So we have to start to understand how we just don't lose some of these expressions, even from trauma that happened so long ago. So, what we have to work to do first and foremost is we have to work to change this question, because it's until we change the question, we can't start to intervene differently. And we have to understand that when it comes to addressing trauma, we all play a role. That intervention takes many different forms. That sure, there's therapeutic interventions. And even with therapeutic interventions, we've got to recognize that trauma isn't cured. But what we also have to remember when it comes to intervention is you don't have to be a therapist to be therapeutic. That the research is really clear. For 2/3 of individuals who experience chronic trauma, they don't need a therapist, psychologist, counselor, or social worker. The only intervention they'll need is that of one buffering, unwavering support. Let me say that a little bit differently. That the power of the authentic relationships, the authentic, unwavering relationships we build, they're so powerful, it has the potential to mitigate the trajectory of trauma. And what we have to understand is that we all have the capacity to play that role. That when it comes to addressing trauma, we all play a part. But in order to be that one buffering, unwavering support, a few things we do have to recognize. We have to recognize that even unintentionally, I may trigger someone's trauma. That for one person, putting my hand on their shoulder means I got you, I see you, you're safe. Even though I'm trying to communicate the same thing to the next person, putting my hands on the next person's shoulder can instantaneously trigger that fight, flight, freeze response. That wasn't my intention. So we have to work to see those changes in responses and behavior and understand trauma, which means we have to start by changing the question if we're going to work to effectively intervene. Now, we'll talk a little bit more here later about how to effectively intervene, because many of you have even asked, what do I say? What do I do? I'm not a therapist. My job isn't diagnosing. And our intention isn't to have you all play the role of a therapist, but recognizing how there's great power in not being a therapist as well. But it starts by changing the question. So let's start to think specifically about workforce development here, about how each of you in various capacities, whether you work for a workforce development agency, whether you're with the Department of Corrections to help individuals be able to navigate that re-entry process, thinking about all of the different phases we may have to consider. And so you all are workforce development professionals. And so from all of my work in the workforce development sector, something I've done is I've kind of oversimplified this into 3 phases that we have to consider intervening, and 3 phases we have to especially consider. And then a 4th phase that I'll talk about. So the 3 primary phases we're going to look at are that phase of acquiring those job readiness skills. So either learning a new skill or, maybe enhancing my skill set, thinking about obtaining employment and that process of, filling out applications, going on interviews, maybe even being rejected multiple times before I get that job. Then thinking about how it's not just about getting the job, but it's also about how do we support people in successfully keeping their employment. Because we've all encountered those individuals who seem to be able to get a job with no problem, but keeping it is a different story. And then the fourth phase that we sometimes talk about, especially when it comes to considering trauma, is thinking about transitioning to either new employment opportunities. So how as I go for a promotion, or I transition from one job where I know what the opportunities are, maybe to a different organization or agency and take on new responsibilities, and how sometimes my own trauma may keep me from taking those advancement opportunities. So what I want to start by doing is I want to start by asking you all to engage in a conversation.
Discussion with some of the participants.
Monique, is that a question you have?
What are the chances you and the
So what I'm going to ask you to do is I'm going to ask you to think about within these 4 phases, what are some of the common issues that you see for clients in any of those 4 phases? So we can start to be really specific and really gear the rest of this workshop towards meeting those needs of how throughout these 4 phases do we really start to conceptualize what are the things to consider and how do we support employees given the prevalence of trauma that they may have experienced. So we're going to go back to our breakout rooms, and I'm going to put these 4 phases in the chat box for you all so you see them. But we'll go back to our breakout rooms, and I want you to start to have that discussion. So then we can then cater this more closely to that. So what you'll see here popping up on your screen once again is you'll see that joining the breakout room. And we're going to take about 10 minutes in those breakout rooms to have these discussions. And again, I'll put those 4 different phases that I want you to specifically look at to think about how we can intervene. So on your screen, if you don't see an option to join a breakout room, please go ahead and just let Brittany or I know, and we'll work to get you in that breakout room.
Mr. Sean,
Yes.
hi. Can you put the last slide back up so that I can see it?
So you should see those messages broadcasted, but I will go ahead and put up the slide just so you can see it. And if you want to take a
Because
screenshot.
we don't see it. I couldn't see it when I went into my breakout room.
Okay. Do you see the slide up?
I do.
Wonderful. I'm gonna.
Why? I'm just gonna write it down so when I go back, it's already.
It should be in the chat.
Okay.
I think you put it.
Okay. So, Mr. Sean, can you send me back to my breakout area?
Yes, and Miss Wilson, right?
Yes, sir.
Okay, just making sure I'm sending the right person back. Okay, so what you should see if you look at the toolbar, which may be either at the top of your screen or the bottom of the screen, you'll see something that says breakout rooms.
I do.
And just click on that button.
And I can just join back.
And you can just join back.
Thank you.
Absolutely.
Hi, can you put me back in breakout 1? Because we couldn't see the phases.
Okay, absolutely.
Thank you.
So I just put you back in, but what you'll have to do at the bottom of your screen, or maybe at the top of your screen, wherever you see that toolbar, you'll see a button that says breakout room.
Okay.
Just click that button and it should send you back.
Oh, okay. Oh, hold on. Let me see. Uh-oh. I don't see it. Meeting, disconnect. Yeah, I don't see it.
Okay, I'm gonna.
Sorry.
Oh no, you're fine. We want to make sure you get back in your breakout room. So
I was with breakout 1, I believe. Okay. It was with Tamara Williams.
So hold on just a second. I'm gonna try to do something fancy and make that button reappear, but don't do anything for just a second, okay?
I won't, I promise.
Okay, now go. You should be back in 1. Do you see a button on your screen?
Okay, let's see. Let me go this way. No.
Do you see where it says on that menu where it says things like participants, chat, video, mute?
You have to like scroll over the bottom part of it, like hover over it, and you'll see a panel that has like a microphone, a video camera. Still there? I think she went in.
Can you hear me? Can you hear me?
Yeah.
Oh, wait. I think it just popped up. Oh, wait a minute. Hold on. Well, okay. I don't know.
Do you see a bar when you hover over the bottom of your Zoom screen? There should be like a microphone where you mute yourself, a video camera.
So in just a few moments, you'll see participants rapidly coming back into this larger space as those breakout rooms close. And so, as you engaged in those rich discussions across those four different phases I noted, whether it be the acquiring the skills, whether it be obtaining the employment, keeping employment, or either career advancement, I want to know what were some of those challenges that those clients you have the privilege of serving may experience during each of those different phases. So share with me some of those conversations you had in your breakout rooms. And also, I popped in on some of those various breakout rooms, so I know there was a lot of rich discussion, and I'm happy to call on rooms if I need to.
Sean, this is Joy. Can you hear me?
I can.
I was in room number 9, and actually, I'm with the Workforce Initiative team with Department of Social Services. We actually had somebody with child support and also probation and parole in our room, and then Gail with Arches chimed in as well. So we talked a lot about childcare issues going around right now across the whole state, where it actually meets each one of those 4 phases on all different levels. And then we had a lot of discussion on individuals that are getting ready to be released from the correctional facilities, and also the individuals that are on probation and the services that are hard to find for them. And the last one that we really touched on, and I really didn't think about it, so thanks to our probation and parole on this, is the homelessness and the people that are not wanting to take up on the help and the services that are out there.
Yeah. So, Joy, it sounds like you all really had a rich discussion, and let's start to name some of these things more acutely. So, childcare, especially during this time, childcare is a major concern, especially as we see in some regions schools are shutting down, classrooms are randomly and unpredictably being quarantined, where certain classrooms aren't able to go back, of knowing there's a lack of childcare, of recognizing that that can really impact every single one of those phases. Absolutely. Also, wanting to recognize, and I know a lot of things were said here in the chat, and so I want to give voice to them too. Sounds like a lot of you said childcare. Recognizing how transportation's an issue, how in order to get the paycheck, you've got to have transportation, whether it means having bus fare, or in some regions, there might be not accessible transportation. And so it's not just bus fare, but it's almost like you've got to have money before you can even have the transportation. But you need a job in order to have money, in order to have transportation. So it seems like some people may already feel like they've been set up to fail before they've even tried. And this was noted often. How is it that a criminal record in our society impacts people's ability to obtain employment? That as criminal background checks are done, that it keeps many people from being able to even get their foot in the door. And so sometimes what we can see is individuals who've had these traumatic experiences of employers finding out about a criminal record, that they suddenly get fired. So sometimes we see individuals with criminal records not even wanting to disclose that they have a criminal record, or becoming just almost hopeless about their potential for even being able to acquire employment. Literacy being an issue, absolutely. Issues with getting needed documentation to sustain employment, whether it be birth certificates, social security cards, picture IDs, recognizing as many employers now are required to be part of the e-verify system, that if you don't have your employment documentation within X number of days, and how sometimes that can be a major barrier. So I want to pass it over and pass it back to you all. What are some of those other discussions you had? So I'm not just reading what's listed in the chat box, but really thinking about throughout each of those different phases, so we can think about how is it for each of these phases we start to intervene. Who else feels empowered to voice?
You want us to talk in the chat or not?
No, I want us to I'd love to hear your voice, Stephanie.
Okay. So I'm from probation and parole. And one of the things that I noticed is even when my clients are able to get a job, that a lot of times they aren't able to retain their jobs because of underdeveloped soft skills. Like they're not used to having a routine or used to getting up at a certain amount of time and allowing enough time to get there and be on time, that they're not able to have higher job retention.
So those soft skills of when I have to address conflict in the workplace, of getting up at a certain time and being in a routine. Absolutely.
Mhm.
Tom, did I see you come off mute as well?
Hello.
Hi, Kiana.
Hello, I'm Kiana. I'm the family service worker here with Urban League Head Start. And some of the issues that I run into with my families and my parents is they're able to obtain the jobs, but they're afraid of losing the benefits that's helping them, maintain their household as far as like food stamp benefits, the TANF benefits and things like that. So it's like once they make a certain amount of income, it still is affecting their family because they balancing, the income as far as money to be able to pay the rent, to be able to pay the utility bills, but they're still relying on the food stamps because they only have enough income to possibly be able to cover for rent those days. So that's the kind of issues that I kind of have as far as making sure that my parents are able to retain their employment. So just transitioning and trying to get them to, come out of the generational curses of hey, my mom or my grandma, they made it this way depending on public assistance, but the issue is just trying to get them to come out of that mentality that I have to rely on this public assistance at all times instead of, being able to maintain that full-time job and learning how to live life pretty much with just, living off of income.
Yeah, so recognizing that sometimes the income we obtain isn't enough to meet all of the needs, right? And so it seems like there's this big gap of I may fall in the gap where I no longer qualify for those additional services I need, but my income isn't meeting all of those needs. And so recognizing how there is a systemic gap that many people fall into.
Yeah. So to piggyback off of Kiana, hi Kiana, how are you? That was some great
Hello.
information. To piggyback off her is most of our families that I'm a child care provider as well. Most of our families are on subsidies for a reason. And that gap, that financial gap is a big factor in our families not moving forward. That is a huge factor, from our parents that come out of prison to our parents who live everyday lives and never do anything to, to get caught up in the system. They are all fall in that gap. You either have too much money to qualify or you don't have enough to survive and you end up going to those food pantries. So just to have that stress, and it's as a provider, even though I'm a director, I still use those same subsidies that my family use. And I fall in that gap to where I can't even pay for my own health insurance because I have to decide if I'm going to pay for a bill.
Facts.
Because I don't qualify for that Missouri medical benefits. I make too much for that, but I make too much, or I don't make enough to buy private.
That's a total conundrum.
Absolutely. Absolutely. So recognizing how sometimes even as service providers, we fall into that gap area, right? And unfortunately, the gap is too big. And in Missouri, knock on wood, we hope with that Medicaid expansion that we see some of those needs become alleviated. But absolutely recognizing, and so what does the hurdle then become for even seeking employment
If
opportunities
I could say
when it
something.
seems like one way or another I may fail? Is that
Yes.
Jamie?
Well, what
Yes,
I would
please.
like to say is it's not all, exclusively on the client. Sometimes it's the processes that, in my opinion, in a lot of corporations are archaic. They have third-party background companies that really just run your name, and it takes a lengthy time to get a result back. So you got a guy that's coming through the door, just got out of prison. He's trying to make good with his time, but he has a parole officer that doesn't get it, doesn't understand that barrier that exists between just the sheer time that it takes to make a decision on someone that's just as involved. And I think that's where they get caught up, right in that gap of you're starting off, you're doing the right things, but you have a time limit, but the system isn't really working in your favor to actually get you employed in a decent amount of time. And it's not always that he doesn't have the skills. It's just that they have a lot of third-party companies that hold up the onboarding process for people who are struggling.
So recognizing how sometimes there are unrealistic time
Yes.
restraints, people, that it almost seems like people are set up to fail from the beginning.
Absolutely.
So, and one of the things I do see listed, and we save the chat to try to make sure we answer and provide resources for all of those questions. But, one of the things we do try to do is provide you then with some of the resources and ensure that those hubs also are providing those resources to really set individuals up to succeed. One of the questions, and I don't know, Lana, if this is in your region, but in the St. Louis area, through St. Xavier College Church, as part of their social justice mission, they understand how, there are implications, especially for criminal justice involved individuals who are trying to re-enter and trying to be successful. That something like those IDs and birth certificates and social security cards become a huge issue. And so I put that program in the chat box for people to be able to access that. And so making sure that that's a service. I also saw that healthcare can be a big issue, especially for individuals during this time of also where it may seem scary to access healthcare, and wanting to recognize how in the St. Louis region we have the Gateway to Better Health program to help cover some Missourians who may fall below the income gap, because we know currently under Medicaid that that's not being addressed. But in the St. Louis region, we have access to the Gateway to Better Health program that can at least get individuals in the door to one of our healthcare home facilities, those federally qualified health centers. And we'll put that information in the box. But thinking about how is it we collaborate to start to identify these needs, that as we work to build those systemic changes, that we're also meeting those immediate needs. And so we'll make sure that's in there as well. I want to see, because in one room there was really rich discussion, and I don't want to call out the room, but I want to see, is there anyone else who would like to share any conversation you had in your room, breakout rooms, about those 4 phases, because sometimes, like you all noted, people have this resiliency to be able to get jobs, but it's the keeping them. Or sometimes we see that fear of career advancement, and it may not always seem logical to us that people aren't taking those career advancement opportunities, but sometimes it may be fear holding people back. And then also thank you, Lashana, for sharing other resources around our state.
Sure, I'll say something.
Thank you.
So in our room, we were discussing, I brought up the myth of the pulling yourself up by your bootstraps. And when most people don't have bootstraps to pull themselves up with, they have this, people are met with this, well, why can't you do this? Why can't you do that? And often people who are on the outside looking in, who live a more affluent life, don't understand the struggles of those who are in plight and in poverty. And so they tell them, well, you need to get your life together. And they're trying, but we know that poverty has this gravitational pull that every time you try to dig yourself out of the hole, something knocks you back down in the hole. And people get weary, they get tired, they grow frustrated with the process. And knowing, okay, they want better, and they can see better. However, certain circumstances keep them from reaching better because they're just tired. They just grow weary, and they just get tired of fighting through the system, because the more things change, the more they stay the same. We know that the system is systemic oppression all around. We can't get around it. And the more we come up with ways to combat it, the more it evolves. So then you get tired of trying to fight a system that continuously evolves to keep people marginalized and oppressed. And some people just give up.
Yeah, that it can feel hopeless, right? And that for many individuals who experience chronic trauma, to try to help them think long term can be really hard, because they're not used to thinking beyond today, because they've had to survive rather than even thinking about long term. And also thinking about recently in working with a group of clients, it was very interesting how, as we meet some basic needs, as was just mentioned, how other hurdles seem to come up. That, yeah, a client was able to get a car, and then you know what, less than a month later, they get this bill in the mail about property taxes they have to pay for on their car. And they're like, I'm barely able to afford a car and the rest of my bills, and now I've got to pay $200 on this car, and how am I supposed to do it? That sometimes it feels like for every step forward, there's 2 steps back. And how is it that we legitimize that experience of trauma in an effort to help individuals build the tools and also take advantage of some of the opportunities? Because we know that the system can feel like it's stacked against individuals, right? And in many cases, it is stacked against individuals. So Erica also shared a really great resource that I want to highlight, and it's a statewide database for workforce professionals to get those resources. And you can put in your own agency information as well as access other resources that may be available. And the more we can reduce and help to set individuals up to succeed, the better, because of exactly what was communicated. So I want to share one more slide before we go on our final short break to finishing out our and concluding our training together. So and there was an interesting question posed of how does this space become a networking space? And so one of the things we can do is I'm always hesitant to give out others' email addresses without permission. So one of the things we can do is set up a brief survey if you're interested in sharing your information with a larger group, that we can facilitate that. But I'm hesitant once again to share information without permission to share that information. But I'd be really happy and really excited. So Lana, I think that's an amazing idea for us to all be able to network. So we'll brainstorm and see how we can facilitate that process. So this was something that we continue to see, is that trauma, as many of you all have noted now, is that trauma impacts even our social functioning, right? But too often, the recognition of how it may impact our social functioning, of how trauma becomes transgenerational, isn't noted. So on this slide that you see on your screen here, this is some of the implications of one's ACE score, those ACEs we talked about from the original ACE study. And this co-occurrence with all of this social functioning. So I want to, in this case, tune in just to the first third here as we look at absenteeism, which was defined as missing 2 or more days from work per month, and how we see this dose response correlation, or this graded relationship, with the more types of trauma experienced in childhood, the higher the incidence of missing work as an adult. So now I'm going to ask you all to make the connections here. Why is it from trauma I may have experienced in childhood, I'm more likely to miss work as an adult today? Something's triggering my past trauma, lack of coping skills. Recognizing that the symptoms of trauma aren't persistent, they're episodic, meaning anytime my trauma becomes triggered, those symptoms arise, whether it's the depression, the anxiety, the feeling unsafe. Or, as Rebecca noted, maybe a lack of coping skills. So when I am triggered, maybe I gain in those unsustainable coping skills, like maybe substance use or avoidance of those triggers. But what we also want to recognize is sometimes those triggers for my trauma aren't just in my personal life. Sometimes they're also at work, right? And so missing work becomes my survival technique. Did I hear someone come off mute there? Okay. So also wanting to identify things like that cold that's going around work, I'm more susceptible to getting because of a weakened immune system already, because we know how trauma impacts our immune system, as well as recognizing how trauma also correlates with that diabetes, cardiovascular disease, ischemic heart disease, certain types of cancer, that literally I might be sicker. So how is it as workforce professionals we integrate this knowledge of trauma in order to better support those clients we're charged with supporting to help them succeed? So we're going to take one more short break before we continue with the last segment of today's workshop. And so we'll take till 12:30, meet those biological needs, don't work, and then we'll move on with the rest of today's training. Welcome back as we're on our final leg of today's workshop. One of the things I see in the chat box is that many of you, unfortunately, because of other obligations you may have, that you may have to log out early. And we understand there are always conflicts with times and schedules, and we want to say thank you for joining us today for this important information as we build an alive and well community, working to disrupt that process of trauma and toxic stress. If you are one of those individuals that do have to sign out early, I want to go ahead and put the evaluation link in the chat box. And if you'll take an opportunity to fill that out for us, we would greatly appreciate it. One of the things that we have to do for our funders is we have to provide feedback, and the more feedback we get, the better. So, in order to continue to provide these opportunities, not just for the workforce development sector, but for other sectors, as well as provide following deeper trainings, we need you to fill out that evaluation. And for those of you who are able to continue to be with us, thank you. And we're going to go ahead and share a screen as we move through this last segment of the workshop. So one of the things we have to recognize as we think about wanting to intervene and recognizing that each and every single one of us play a role when it comes to addressing trauma is recognizing that there may be a perception of helping professionals. That one of the things we naturally assume is that because I'm your parole officer, because I'm your reentry coordinator, because I'm your case manager in workforce development and supporting you to get this job, that people should naturally just trust me. People should naturally just do as I say. And one of the things we do have to recognize is we have to recognize how there's a perception of helpers, because whether or not we feel like it, we represent an authority figure, and how just by the nature of wanting to help, that there could be some things that get triggered and those we're charged with serving. So recognizing that there may be a distrust of authority figures because everyone that client has trusted in the past has let them down. Recognizing how authority figures, because of past experiences, may be the source of hurt and harm, and how just in interacting with authority figures, we may see that fear or anxiety. So recognizing just because I'm a helper doesn't mean that people are just going to instantaneously open up, do whatever I say and how I say it, right? And being aware that there is that perception. Now, many of you have asked, what's my role in supporting this process? And one of the things we have to recognize that as we're supporting individuals, again, our role and our goal for today is not in helping you to become therapists, but recognizing the profound power that each and every single one of you do have. But the very first thing we have to understand when it comes to intervening and supporting recovery is recognizing that my job is not to fix the trauma. That sounds really weird, right? You're in a trauma training as we're talking about trauma, and here you have this guy telling you, don't try to fix the trauma. Here's the thing. Too often, as helping professionals, as people who love to fix, right? We get this kind of high off of fixing. But what happens in our attempt to fix is too often we invalidate the experience of someone's trauma. That, quite frankly, think about this. If there was a magical solution that could have been brainstormed in 3, 5, 10, 15 minutes, don't you think the individual would have come up with that magical solution? My job as a therapist, believe it or not, is not to fix the trauma, but how is it that we help individuals, in spite of the trauma, to reconnect and to regain a sense of loss and the ability to navigate and move forward. So, even as a therapist who's trained in multiple trauma interventions, my job is not to fix. Your job is not to fix. That recognizing how, when we attempt to fix, we may create greater harm than do any remote sense of good. So, our job is to change the question. Now, in changing the question, let me be clear. That does not mean we go up to every single one of our clients, colleagues, family members, and friends and say, hey, you know what? What happened to you? Not your job. Changing the question is about changing my own mindset. That when I see myself wanting to ask that what's wrong with you question, I change my own mindset to thinking what happened and what's continuing to happen, so I can show up as that buffering, unwavering support. How is it that I build that relationship? Because too often what we don't recognize is the power that comes from relationship. Think about how crucial for you your support system may be, how crucial your partner, your best friend, your families are. But also consider, for some individuals, they don't have any authentic relationships. That how is it that we're validating and understanding, and that in our relationships we're unwavering? Doesn't mean we have to approve of what everyone does, but how is it we say, I'm going to be a constant support here for you? And also wanting to be sure that we're transparent in everything that we do, meaning that we also can't make promises we can't keep. So meaning you might be a mandated reporter, right? And that if someone says, what you got to promise not to tell or say anything, we can't make promises we can't keep. So if someone asks me, how is it that I'm validating and supportive, and say, you know what, I'm always going to try to do what supports you, but sometimes it may mean having to do things I don't want to do or I don't like to do. But I've got to keep everyone safe. So making sure we're not saying you'll never be hurt again. We're going to get you out of this situation, or this path is going to be easy. You just got to listen to what I say. That we don't make promises we can't keep. And that when appropriate, we refer and collaborate with organizations. So too often, our first inclination is send them to a therapist, connect them to services. And sometimes that might not be appropriate, but when it is appropriate, how is it that we create that warm introduction? Not handing someone off like an object, but a warm introduction. Not just saying that here are the services, call and make an appointment, but how is it, I know you need the support, so let's work together to do this. How is it that we appropriately refer and collaborate? Which is one of the reasons why this neighborhood healing network is so revolutionary, because it's a resource in our very own community, in our very own backyard, for us to be able to refer when those supports are needed. So one of the ways we think about supporting the recovery process is by infusing these core principles into everything we do and to how we work and operate. The principles of safety, trustworthiness, choice, collaboration, empowerment. and that all of these core principles are applied in an equity-centered framework, that equity has to be the glue holding them together. That recognizing as long as that inequity persists, we can't truly be trauma-informed in our approach. So let's just start to explore some of these. So thinking about when fostering safety, recognizing that safety isn't just physical safety, but it's also psychological safety. And we can't truly be safe unless we have both of those components of safety. So how is it that we foster physical and psychological safety? How is it that we build the trustworthiness and the relationship? How is it we give authentic choice rather than just perpetuating choice as, there's a right choice and a wrong choice. And if you choose the wrong choice, there are going to be consequences. Because we also have to recognize how sometimes in life, when we've been given choice, the consequences were very real and very painful. So how is it we give authentic choice? How is it we collaborate with individuals rather than doing to and for them? Just saying, do this, do this, do this, and collaborate with individuals to ultimately work on empowering them. So when we apply these core principles in an equity-centered framework, how is it that we ourselves and our environments can help to support that trajectory of trauma, can intervene? Because some of you all may be required to do a trauma screening, but recognizing looks like someone is off mute there. So recognizing that when we build these environments, it's not about having to do a trauma screening. It's not about having to diagnose, but it's about building that supportive environment to help anyone who's experienced trauma succeed. So I want to take a few minutes for this final breakout room that we have, and I'll put this again in our chat box, is thinking about in your role, in your capacity, not being a therapist, but being that buffering, unwavering support to mitigate that trajectory of trauma. How is it we can, to a greater extent, infuse these principles in how we work and operate to support the success of those we have the privilege of serving? So we're just going to take about 5 minutes in this last breakout room, have a group conversation, and then just some closing thoughts. So we are right there on that last stretch after our 4 hours together. So one last breakout room, and I'll put it again in the prompt. So go ahead as these rooms open and join your room to engage in those discussions.
Sean,
Uh-huh.
it was wonderful. I'm having to go. I've got another meeting at 1 that I have to prepare for, so it was wonderful.
Thank you so much, and we'll send out the slide deck as well as that evaluation link and any resources.
Okay, awesome. Thanks.
Thank you so much.
Bye-bye.
We see people coming back from their breakout rooms now, and I just want to ask, what were some of those discussions you had of how is it that we enhance the promotion of these core principles to support all of our clients who have experienced trauma, whether we're able to recognize it or not, identify it or not, or whether it's been disclosed or not? How is it that we can enhance these core principles? What were some of those discussions you had?
Well, Sean, I
Go,
think I, oh,
go ahead.
Sean, I think I can talk now. We just talked a little bit about um, finding ways to connect the folks that we're working with under certain circumstances with beneficial mental health services that can provide them with the kind of assistance at free or reduced cost so that they can um, reach some level of stability and be more successful in the programs that we're trying to provide for them and the employment and training options that we're trying to set up.
Absolutely. And so recognizing what are those resources we have in our community. And one of the great things of the Neighborhood Healing Network is those supports are available at no cost in the St. Louis area. Recognizing not all of you are in the St. Louis area, and we're going to work that if you're in an area that's not St. Louis, that we help connect on those supports, but wanting to know that those supports are available. Um, in the chat, Kim mentioned that Monique was sharing something really, really rich and valuable. And so I'm wondering if Monique would be willing to share with us in the larger group what was being shared.
Everybody. Sorry, I had to switch over to my cell phone on this. Let me get my video up if I can. So our group, we did initially have a bit of technical difficulty, but once we got discussing, it's just interesting how in our varying capacities in our roles in social services and similar fields that we do engage with individuals that have varying backgrounds, varying circumstances, and these principles are things that we should be very mindful of as we engage, because of course our experiences are not that of others and vice versa. So we have to be sensitive to those conversations and encouraging while maintaining, a level of respect and confidentiality in the process.
Absolutely. And it sounds like you all had a really rich discussion. So thank you so much, Monique, for sharing that. Jamie, I see you're off mute.
Yes. I basically was talking about trustworthiness and talking about those healthy boundaries, because what stood out for me was when you spoke about a person that can take maybe the touch on the shoulder as a fight or flight response, or someone can actually be calmed by it. But I think that just making sure as service providers, we keep a professional, relationship with our clients, not to over promise, make sure that we're telling them realistic things, giving them realistic expectations, and also going to the mandated report aspect of it. If you keep a professional, rapport with them, maybe you don't have to get into those complicated situations where someone tells you something that you have to compromise y'all trust in the first place.
Yeah, absolutely, Jamie. And that's crucial, right? And so
Yes, sir.
so recognizing that in and we'll get there, but also recognizing that in part it means that we have to take good care of ourselves in order to show professional, in order to be that one buffering unwavering support. Recognizing at the very beginning of this, I asked you all, how are you feeling right now? And how many people said something along the lines of tired, overwhelmed, anxious, exhausted, frustrated, overworked, burnt out? So recognizing that part of this is also about how we take care of ourselves for how we show up for others. And then I want to see, is there anyone else who has something to say or just share with us from their group? Kiana noted how the rapport we build, that relationship, a lot of times we undervalue the importance of relationship. But I can't tell you enough how relationship is key. Even for me as a therapist, if there's not that relationship between me and my client, we do no good work in a therapy session. Relationships are crucial in every single aspect. That until there's a relationship, we can't begin to mitigate that trajectory of trauma. So I want to share one final resource um, before I share some closing comments. And in addition to the Neighborhood Healing Network, that's such a fantastic resource in the St. Louis region, we know that not everyone is here in the St. Louis region. And so, right now, during this time and experience of COVID in our community, as a result of FEMA dollars that have come into the state, Show Me Hope is providing counseling as well as crisis intervention resources across the state. During this time. So we know that as a result, during this time, there's greater access to the support services and resources for crisis intervention, even counseling, and even getting some of those needs met. So noting if you're not in the St. Louis region and you don't have access to one of those fantastic hubs through the Neighborhood Healing Network, know that there are other resources across the state during this time. The other thing I want to highlight, as I mentioned, and just as we think about our concluding thoughts, is that in today's training, I shared with you all that it takes one buffering, unwavering support to mitigate the trajectory of trauma, meaning each of us play a role in addressing trauma in our community. But we also have to recognize that we are part of the community we serve, how we may be experiencing trauma, and how I may be experiencing stress myself. So, part of being crucial to the answer to mitigating trauma also means that I'm taking excellent care of myself, especially during these heightened times of stress. So, with that being said, we're going to stick around to ensure that if you have any questions from today's training, that we take an opportunity to answer them, but also want to be thoroughly respectful of your time, that many of you have commitments and have tight, busy schedules. So, one more time, if you would take an opportunity for us and complete that evaluation, we'll also put that in the final email. But complete that evaluation about today's training so we can continue to offer these important opportunities. And then we've got, before I turn it over to Archis to conclude us, we've also got a request from Archis that if you all could just do us a favor for our funders and turn on your cameras for just one quick second so we can take some group pictures to say, look, there are people here. We're not just talking to ourselves. We would be very appreciative. And so I'm going to turn it over to Brittany to take the group picture and then conclude with any final comments from Arches and the Neighborhood Healing Network.
Okay, can I see? I'm gonna have to take two pictures because my screen can only fit one. So if everyone can give me their pretty smiles. 1, 2, 3. Hold on one moment. Okay, I'm going to take one more. So hold on. Okay, 1, 2, ready, smile, please. Great. Let me save this. Okay, so I just want to say thank you to everyone that attended. We know that A lot of Zoom meetings has taken over our lives, our bedrooms, our homes, our workplaces. But I think Sean did an amazing job just being able to share the importance of why this type of work is needed, and the type of work that each of you are doing within your agencies. Arches, as well as the Neighborhood Healing Network, is here to support you in whatever way that sees fit. So please reach out to either myself, as well as the flyer that I've attached that lists each of the community resource specialists' contact information. We understand that it takes a community to create systematic change. And as much of you have stated, we are fighting against oppressive systems. And so that's going to require an extra level of support as well as teamwork. Thank you, Sean, for always giving a great presentation and also for the level of engagement. This would not have been possible if everyone just sat in the background and, just turn off their cameras and just did other things. We definitely appreciated the involvement for today's training. And at that moment, I give it over to Sean. I don't know if he has anything else to add.
Just thank you all for the vital work you do each and every single day in our communities. And thank you for being part of the solution for creating an alive and well community.
And we will send out the slide deck via email within 48 hours. So thank you all.
Have a great
Have a great day. Bye.
Thank you. Bye, guys.
Bye-bye.
Bye. And Sean will follow up in regards to the contact list.
Okie dokie.
Okay, bye.
Bye-bye. Leave.